According to the report by the Non-Communicable Diseases Alliance East Africa, non-communicable diseases have become the leading cause of death in most countries, resulting in 200 million deaths among people aged 30 to 70 years, with 80% of the deaths happening in sub-Saharan Africa. The Non-Communicable Diseases Alliance for East Africa is now advocating for a coordinated voice and advocacy to address the growing burden of non-communicable diseases in the region.
So the first thing which we did was we did a gap analysis within the East African countries, trying to look at the different components of NCD programs within these countries. So that gap analysis, which looked at the health sector, it looked at the patient's perspective, it looked at the community perspective, and it also looked at the legal perspectives. And what we found that in most of the East African countries, there was a lot of disparity between the different programs within the national NCD strategy. And what we thought that we as an East African NCD Alliance, if we can find a common framework within which all the countries can move together, that would be a much better thing.
The East African Community Regional Strategic Framework on Non-Communicable Diseases Prevention and Control 2024 to 2030 is also in place to guide NCD programming.
The regional approach is just to help us to be at the same level by supporting other countries, by sharing best practices, and also to reduce the costs. Because when we are speaking the same voice, we can attract more resources.
This is the framework, and that's why we call it the East African Community, because it was initiated by the Secretariat itself. And then they said, because we have the burden in East Africa on NCDs, can we come together and try to come up with a strategy of where we can implement and make sure that services reach down to the people.
The East African community has realized the need to bring together member countries and relevant non-state actors to address the growing burden of non-communicable diseases, because they are now the most pressing health challenges of the time.